Mr. Mayor, thank you for the opportunity to update you on where we're at with our health outcomes. Health targets get produced by the Ministry of Health every quarter, and we've brought you a poster to circulate of where we're at with our Lakes DHB performance at the end of the third quarter for the financial year that ends at the end of June. So we are in the top 10 DHBs on all measures except for immunisation for children at the age of 2 being fully immunised, and on that one we're currently ranked 16th. But hopeful that we will come up into the top 12 on that measure before the fourth quarter as well. So what we can say is that anybody diagnosed with cancer will get treatment now and be into a program within 4 weeks, because that target's just reduced from 6 weeks to 4. We're in the top 4 district health boards for access to elective surgery, and we're actually performing, on that next slide you'll see, at 107% against contract for elective surgery. So we think that's a really good news for the community, because that means more people than ever before getting surgery, and we've just received a bit of additional funding for another 120 people to get surgery over and above our contract before the end of June. So that's a first for us to be offering that level to so many people. So we're very pleased about the confidence that the government's shown in us around that. Nick touched on the Taupo maternity project, which was in response to a proposal that we received just over a year ago to establish a private maternity service for this community. We went into a consultation round and had quite a number of public meetings and submissions, etc. The end result is that the community said that they wish to continue to have their maternity service offered through the public service, both funded by Lakes DHB and provided by Lakes DHB. So, but we did receive quite a bit of feedback about ways we could improve, and some of those related to us revisiting the design of the new maternity unit. And Julie Eilers, who I'm sure you all know, is our Taupo Hospital manager. Julie's leading the team, working with Nick to do that redesign. There was also a request for better collaboration between the health providers involved in maternity and better information for service users around maternity services. So Sue Wilkie, who's our comms person, Sue has set up this website which we've listed there, www.taupo.maternity. So I encourage people to have a look there if you've got questions around what we'll be doing going forward. And in terms of the other recommendations, there was a requirement for us to have more culturally responsive services. So we've got a team leading that, working with iwi governance, and Gary's our Director of Nursing and Midwifery, and he'll be leading the work around how, what we call models of care, how the teams work together and work with women to get the best possible result. And we're anticipating about a year to deliver all of that work. I'll leave a copy of the full report for you. There's a lot of change happening in health, just as there's been big reforms in local government, particularly in the Auckland area. The government also expects district health boards to work a lot more closely together on a regional basis. For us, that's been part of the Midland District Health Boards, which has Gisborne, Waikato, Bay of Plenty and Taranaki. And there'll be quite a few reconfigurations around how services are provided, and that information's all on our website. One of the other parts of the health reform have been changes in primary care to what the government call better, sooner, more convenient primary care. That has meant quite a change for this community. You used to have Lake Taupo PHO, your primary care services, GP, community nurses, etc., not counting district nursing, but are configured now through something called the Midlands Health Network, which is a big organisation run out of Hamilton that's got 500,000 population that they serve. So that covers Turangi and Taupo. Mangakino is just in the process of moving to another a Māori provider entity, the Mangakino practice. So I'd have to say that this development is posing some challenges for us in terms of our relationship with this new entity, and obviously along with yourselves, our primary goal is that the people of Turangi and Taupo and Mangakino get the best possible GP services that they can. So we're working hard at our relationship with the network to ensure that happens. And just last couple of slides, things to celebrate at Taupo Hospital. The big upgrade of all the dental health services, including a clinic going in on the hospital site. That was nearly $273,000 worth of investment. We've got a new clinical director working in Taupo and particular specialty in emergency medicine. We're going to be having more frequent and a greater range of outpatient clinics through Taupo. There's an additional number of dementia beds being contracted through some of the aged care providers in Taupo. We now have psychogeriatric beds available in the Lakes District for the first time ever, and quite a bit of investment in the palliative care area. And for your community, we work very closely with the hospice. So just to say, we very much value our relationship with you. You're a very important part of very important stakeholder for the work that we do. Thank you for this work that you've been doing for people with disability. We think this is a really excellent development, and just want to acknowledge that publication. And to say that we are part of the economic sustainability of Taupo across our district. We are the single biggest employer. We have over 1,300 staff and over 200 contracts with 100 providers, and our annual turnover is 270 million. So, we see us, as well as being a health provider, we're also part of the economy, and we know that seeing the economy grow and develop is very dear to your hearts. So we're happy to take any questions that you have. We've got 5 minutes.
Thank you very much, Mrs. Cooney. I'll open it up to the floor to see if the councillors have any questions they'd like answered, and congratulate you. Good to see that the rebuild of the Taupo Hospital is coming forward at a fast rate. Not that far off 2012 now, are we?
I think last time we spoke, we said we needed to have revenue from land sale to cover 6 million, whereas now we've actually been able to find most of the money from other avenues, and we're seeking 1.5 million minimum, but obviously there's still a bit more detail to do around it. So that's a much stronger position than we were in. That is, I think, a result of good financial management.
I believe, I hope I'm not spilling any beans here, but I believe you've actually come in under budget on the road to a rebuild.
We're on track.
We are on track.
We haven't finished
yet. Yes.
Would you mind if we
get
the staff to photocopy what we're handing around there, so councillors can have one each?
It's
No problem. Any questions,
So
team?
to say, from the board perspective, we're pretty committed to the redevelopment of the Taupo Hospital site, and it's really front and centre where the board sort of sits. So we're committed to the dates and to the project.
I know on behalf of my fellow councillors, myself, it's very, very pleasing to hear. It's it's an issue that is dear to the hearts of most people that live in Taupo, the hospital, and well overdue. And glad to see it's going to happen. Anything further? I don't know if I'm going to allow questions for the floor. Because it's you, I'll allow it this instance.
Thank you, Mayor Rick. Morning, Kathy. Lovely to have you and your team over here. This is wonderful for Taupo. I've been here 43 years and we're really looking forward to this. Thank you so much for the input that you put in this morning, which is very complete, so easy for a layman to understand. Now, I wondered about, staffing and things like that, because it's not really that far off, is it really? So, will there be staff able to do all these things and so many different specialised things, which we really appreciate?
Well, I think
I can
I think the short answer is you wouldn't be building a building to put nobody in, would you?
I can respond by saying that our staffing position's very strong. The new clinical director that we have, Dr. Peter Freeman, is absolutely one of the top emergency medicine specialists in the country, and his arrival in this area has meant that some other people have started to express an interest as well. So, and I think Julie's got a waiting list for nurses who want to work there.
We historically, I've been there 19 years as manager. We have always had a meeting lots of job opportunities for people and things like that, creative. The current services have outgrown the facility, so we keep the nursing staff up to date for some space. We're not envisaging a high increase in staff. That's the case. It's going to be a bit more comfortable.
Okay, it's all very reassuring and good news, I believe. Any further questions from councillors?
So we'll leave copies of the presentation.
Yes, please. Well, just on behalf of everybody here, and particularly my councillors, thank you very, very much for coming along, Mrs. Cooney and Mr. Shaw. Apologies for calling you somebody you weren't. That's what's written in the agenda, which just goes to show don't believe everything you read in life. So thanks very much to the rest of your team for coming along, and please pass our condolences on to, not condolences, sorry, our thoughts on to Barry. I know he's in Ward 7 in Rotorua, and he has passed on that if anybody that knows him is passing, he'd love to see them and hear from them. So, yeah, say hi from all of us to Barry, and thank you very much for your presentation. You're actually 5 minutes ahead of time, so I can now give the Friends of Taupo a little bit of latitude. So thank you very much.
Thank you, Worship and Councillors. We look forward to working with you over the coming years.
We'll be up there when the builders start, believe you me.
Thanks, Derek.
Yeah.
Okay, we have a suggested resolution. Please that the information be received. The Lake District Health Board representatives be thanked for their presentation.
Moved.
Have a mover, Councillor Downard. Secondly, Councillor Hickling. All in favour?
Aye.
Moved. Thank you.